Hi everybody, my name is Guillermo Coronel, and today we are going to talk about proteome-wide analysis and CXCL4 as a biomarker in systemic sclerosis. Systemic sclerosis, also called scleroderma, is a complex, heterogeneous fibrosing autoimmune disorder with an unknown pathogenesis. The way in which its three major pathologic hallmarks, extensive fibrosis, vasculopathy, and immune dysfunction, are interconnecting is unknown.
Dysmotility, sclerodactyly, and telangiectasia. What are some of the features of diffuse systemic sclerosis? Some of the features of diffuse systemic sclerosis includes widespread scleroderma, which has a rapid progression, and it has early visceral involvement. What are the antibodies associated with CREST syndrome? CREST syndrome is associated with anti-centromere antibody. What are the antibodies associated with diffuse systemic sclerosis? The antibody associated with diffuse systemic sclerosis is anti-SCL70, which is topoisomerase 1.
This disorder is classified into two major subtypes on the basis of the extent of cutaneous fibrosis: limited cutaneous and diffuse cutaneous systemic sclerosis. Pulmonary fibrosis and pulmonary arterial hypertension are the two most serious complications, currently the major causes of death among patients with this disorder. Thus, in addition to clarifying pathogenic mechanisms, the identification of biomarkers for the presence and progression of clinical complications of systemic sclerosis has potential use in the assessment of disease activity. Collagen production was increased in fibroblasts that were isolated from scleroderma skin and cultured in vitro. Much of the research on systemic sclerosis has focused on altered fibroblast biology. Immune cells are important in pathogens.
Systemic scleroderma. It can also occur in people who are perfectly healthy. It causes the fingers or toes to turn white or blue in response to cold or stress. Digital ulcers are another symptom of scleroderma. They are open sores that can take a long time to heal. It's important to seek medical care and good treatment for digital ulcers. Untreated, they may lead to severe ischemia, which can cause gangrene. This is a photo of a digital ulcer that has grown out of control and is starting to develop gangrene. Gangrene indicates death of tissue. You'll see two fully infected by Raynaud's and scleroderma. Systemic scleroderma can cause sclerodactyly, which is a hardening of the fingers and/or the toes. Not all scleroderma patients develop outward signs of the disease. Many develop internal organ involvement, which is much harder to detect.
Genetic association studies have revealed that the most highly associated susceptibility markers include the genes encoding immune signaling molecules TBET, STAT4 and RF5, and the T cell receptor Z chain. STAT4 and RF5 are both implicated in the secretion of type 1 interferon, a cytokine that has been shown to be present in both cutaneous and peripheral blood mononuclear cells. In this study, we found that CXCL4 levels in patients with systemic sclerosis not only correlate strongly with both skin and pulmonary disease, but also appear to predict progression in systemic sclerosis phenotypes. Collectively, the identification of CXCL4 as a marker for fibrosis and pulmonary arterial hypertension may be helpful in early diagnosis and risk assessment, an important factor in patients who require aggressive treatment. Thank you.